Hi, guys. Welcome to my channel. I'm so happy you're here with me again. And I have a very interesting question for you. Are you struggling to achieve your health related goals and haven't really figured out why you're struggling? If that sounds like you, you've come to the right video. Hi, I'm Dr. Hampton, a board certified family and obesity medicine doc, and with additional training in nutrition and functional medicine. And today, I have a guest who was a guest on the Protecting Your Nest podcast, and I brought him back here today to help us answer this question, about struggle and what that looks like. My guest is Ambrish Sharma. He's a senior informatics research manager with Oregon Clinical and Translational Research Institute and co-founder of MedRGO, which is a company that allows him to follow his passion as it relates to digital patient education and engagement. So, Ambrish, you're doing a lot to reach people who are struggling, and you're going to work with health systems to do that, and maybe directly with clinicians like myself to do that. So, talk a little bit about this idea of why we struggle to achieve our health related goals and things we need to be thinking about so we can overcome that.
I think, Doc, first of all, thanks for having me over. I think one of the biggest challenges that we face is a lack of awareness. And by that, I mean, like, if you're not even aware of how your health works, what is normal and then what is abnormal, and that information for any number of reasons does not make it to you. So I think parts of that is we may be educated but we may not be literate in healthcare. So a lack of health literacy and a lack of education both kind of contribute to that lack of awareness. And so um, you can't really work on a solution if you don't even know the problem. So I think that's one of the reasons we struggle. And then there are like competing priorities. And again, that goes back to the question of a lack of awareness, because if we were aware, we would prioritize our health over, say, our jobs, maybe binging on some show, or or family, or other things that may compete for our time. So I think that goes back to the basic question of, are you aware of your health?
Yeah, I like all of those, and it's very important that we understand how our knowledge or lack thereof can hurt us. And as I think about this same question, I think about my nest and my rope acronym, and if you don't know, I got that from the roots of the functional medicine tree, and so it goes back to, well, what does that refer to? Well, it's the root causes of why we get sick. So, is it because I have inflammation and I'm not balanced and my body's not keeping that in order? Is it because I have some structural issue, maybe a leaky gut that's causing this issue? Maybe my hormones are off, or I'm exposing myself to toxins that are harming me. And so all of these things are the root causes. And my nest and my rope talk about, well, what do you do to put things back in balance so the root causes won't lead to all those chronic medical conditions that we worry about? So I want my patients to think about nutrition probably first. And rather they're doing a low carb diet, intermittent fasting, just they have to fix their nutrition first. Then they have to move their body, but don't over exercise. And then they have to make sure they're getting enough sleep and that they reduce stress. And if they've had trauma, that they recover from that. And that their thoughts are serving them and they don't have self limiting thinking. I also encourage them to be in healthy relationships, avoid organisms and pollutants that harm them. And of course, let's think about our life experiences from the past. Do they serve us, or don't they serve us? So these are the things, in addition to protecting our emotions, that I think are important. I also think about social determinants of health. I think about, am I in a pretty good economic situation so I can actually follow this low carb diet, right? Do I live in a neighborhood where I can actually exercise? Do I have an education that allows me to understand when Dr. Hampton says carbs? Do I even know what a carb is? You know, do I feel that I have access to the food? Am I socially isolated. And because I'm socially isolated, it's going to kind of keep me from being motivated to do the things I want to. And finally, do I have access to healthcare? So when I need to see Dr. Hampton, I can actually do it. So when you think about yourself and when you think about the people that you love and care for, give them a break because they may have struggles that you hadn't even thought about. So my goal with this video is to give you awareness that there are many reasons why we struggle. And our goal as friends, family, colleagues is to help each other through the struggle. I hope my health system does that. I hope that the insurers catch up to this model. I hope the organizations, American Diabetes Association, I hope we all start to understand if we focus on struggle, we'll help people do better. So Ambrish, I appreciate you coming to this video to share your messages and also being on the Protecting Your Nest podcast. I'll make sure to have a link to that episode in the show notes. And for those who came to this video, thank you. Like and subscribe, share this video, and let's continue to walk together to heal from metabolic dysfunction so we can be metabolically helpful. So with that, I only ask, as I always do, that you continue to be safe, be well, and continue to protect your nest.